Good morning. Welcome to everyone. So glad to see you all. My name is Dan Chan. I'm the co-founder of Hawaiian Islands Ministries with my wife, Pam. And we are so fortunate today that on this webinar, we have Lieutenant Governor Josh Green, who I call our own Dr. Anthony Fauci. And he is here to talk to us about what's happening in the state. I'm sure you're concerned about what's happening with COVID, etc. And so we call these seminars at Hawaiian Islands Ministries straight talk, meaning that it's a time when we deal with real issues, real people in real time. And so this is our opportunity to really, at a very critical time, I mean, our timing is amazing. As you saw the statistics yesterday, 355 cases of COVID, and we'll be hearing shortly from the Lieutenant Governor on the latest numbers. But I wanted to mention this, and that after Lieutenant Governor gives us a kind of a summary of what's happening, then we're going to open it up for question and answers. And so wanted you to know, if you're new to webinars, this is how it works. In webinars, it's kind of a one-way communication. We cannot see you. You're going to see me and the Lieutenant Governor. But you can see us, and we will take your questions in the Q&A box in the bottom of your screen. So you can activate that. You can type them in there, and then someone is going to be curating, collecting the questions, and then sending them on to me. And it may not be exactly how you worded it, because we're maybe summarizing, as there are 2 or 3 questions very similar to it. And then we'll try to get to as many as possible. But I'm going to apologize right now. We're not going to be able to address all of them. And we will do the very best we can. And so we have with us Lieutenant Governor Josh Green. As you may know, he is a physician, which is awesome for us, and a husband, father of 2. You may not know this, but he was first inspired to become a doctor while traveling in India as a young man. And then after medical school, he volunteered in missionary hospitals throughout South Africa or Southern Africa, and working with rural populations infected with AIDS and malaria. So he's very knowledgeable about communicable diseases. And he currently serves as a lieutenant governor, and he continues to practice medicine as an emergency doctor on the Big Island. So, Lieutenant Governor Josh Green, welcome. Please join us, and we are so glad to see you. And so we're going to start off. Give us a summary of what's happening. We saw humongous numbers yesterday in terms of COVID-19, but what is happening today?
Well, thank you, Pastor, and thank you for welcoming me, and to everyone who's taking some of their day to share with me as we talk about what's going on. So yes, yesterday was the largest number to date of cases, 355. Over 110 of those cases were connected directly with our prison, OCCC, where there's been an outbreak. And I don't want people to despair. I don't want people to be afraid. I think that that's the important thing, that we remain calm and we do good things. Hawaii, up to this date, has done better than any other state, and still is still doing better almost than everyone in most ways. Our mortality rate is lowest in the country. It's 2.7 of our beloved citizens have died out of 100,000. We've had 40 fatalities, but it has been a large surge in these last few weeks, and we'll talk a lot about that. Sitting back on August 1st, just so people get perspective, we had 2,197 cases. And then here we are on the 14th, so 2-week cycle. It's very good to reflect on 2 weeks. That's the virus cycle usually. We have 4,545 cases. So about 2,300 cases just in the last 14 days. And it was at a max yesterday of 355. Today we have 233 cases, which is very similar minus the surge at the OCCC. So you can get an idea that it's been pretty steady. And if you look back at the last, say, 5 or 7 days, we had, going backwards, as you heard, 355, 202 cases the day before, 118, 150, 152, and 231 cases, respectively, for the last 6 days. So you can see that that's where the trend has been. And that necessitated some significant changes, and I'll explain why in a moment. But as you know, last Saturday, the governor and the mayor made the decision with some of my input for sure, to take a half step back and to pause from large gatherings. I was asking for some time that we went to gatherings of 10 or less just to be safe so that we didn't get large scale transmission of the disease. But large gatherings at beaches and parks was really out of control. As I think we all saw, there were 50, 100, 200 people in some areas all together without masks on. And young people, and I don't mean to be critical, but young people do feel invulnerable. That's the emergency room doctor in me. I know that that's how we behave. And I was there too. I know we all were there. I'm sure you too, Pastor. I could see a glint in your eye. There were days, I'm sure, right, where we all know that when we're younger, it's not quite as risky for us. And so that was causing a lot of spread. So by clamping down on that, we should see usually about 6 to 9 days after any significant change, based on the way the virus spreads, less spread. And so the numbers went up like this, but they should then flatten out and come down. And that is what's necessary. If they don't, we'll have to take other action to bring things back. And I do want to say to you and your leadership, you've been extraordinary, not just because you're a kind person, but you've made some very smart analytical decisions to be careful. I'm not saying these things will go on forever, but it is important to show care when we're all susceptible. And of course, it's not just when we're in our church service. I'm a person of deep faith, and I know what it's like to miss time at church or to be away from what we're traditionally accustomed to. My faith is a little different. I was raised part Jewish, part Christian back in Pennsylvania, which is a combination that happens a lot back east. My wife is actually Mormon. And so lots of different mixes in our lives, but we knew that we have to kind of stay at home more. So let's talk about how it plays out with the infection and the virus and where we are. So 7 days ago, we had 105 individuals in the hospital with COVID. This morning, as of about an hour ago, we were at 173 individuals in the hospital. And so you can again see that the increase in cases is reflected in hospitalizations. In fact, it's almost like clockwork. For every 100 patients that we have in the case count, so every 100, we get 11%, 11 people in the hospital. So yesterday's 355 will be reflected as probably 30 or 40 people into the hospital. Today's 233 will be another 20, 25 people in the hospital, but a couple weeks from now. And that's how that will happen. We have currently 2,747 active cases. And when you look at what 11% of that number is, you can see quickly it's about 290 or 300 individuals who end up being hospitalized over the course of the next 2 or 3 weeks. And then to expand upon that, that number will also break down to how many people end up quite sick in the intensive care unit. About 20% of all of our hospitalized individuals are in the ICU. For example, today we have 173 in the hospital. 41 of our individuals with COVID are in the ICU. That's up 8 from yesterday. We have enough ICU beds as of now. We have 136 ICU beds full out of 244 in our state. It's 56%. And people, when they have COVID, end up having lung problems. That's one of the biggest challenges, breathing. We have 22 individuals who are in the intensive care unit and on a ventilator. So 22 people using a ventilator in the state. We have 459 ventilators available, and we're only using 78, 17%. So we're doing very well there, but of course we're cognizant of what could happen. If this plays out like it normally does, first of all, people who are in the hospital for COVID stay in the hospital an average of 10.5 days, so just a little bit over 10 days. So I can tell you that 2 weeks from now, we will have an additional essentially 300 people that will go to the hospital. 60 people will be in the intensive care unit, and likely 30 people will have the need for ventilators. And sadly, maybe half of those people could pass away. So this is how it goes. And so what's necessary then? How do we make sure we save lives and keep people safe? Well, we do, or at least recommend, the very best things. First of all, wearing a mask, and these are just opinions, but they're strong opinions. everyone should wear a mask around anyone that's not in their household bubble. If you're not close to someone or in your close work bubble where you know that you see them so much that it's impossible to separate yourself from whatever they might catch, you should wear a mask. So having a mask on around all the people that are dear to you is good, but it's a must when you're around any other strangers, because you'll catch it or they will catch it. 2, wash your hands a lot. The cliche is to wash your hands and sing in your mind, happy birthday, well, a lot of soap and water, of course, I'm just playing here, but twice. And that's a good way to sterilize your hands surgically, and that's valuable. Physically distance, always 6 feet, a little more if you can. Honestly, it's better. And then do not gather in groups of more than 10 under any circumstance, unless you absolutely have to. And that does take care of most things. Then, of course, there's what's become somewhat of a signature controversy in the newspapers these days, and that's that contact tracing and testing, in my opinion, humbly, is very, very important. Because if you can't test adequately, you don't know who's at risk and how to, prepare. And you can't contact trace unless you've tested a few people and found they were positive, and then you go forward. So that's very important. Between 30 and 40 people are necessary per 100,000 in a population, which means that we need at least 420 contact tracers activated full-time in our state, up to 564. If you do that, you can contain the virus much better. You can't stop it completely, but you can contain it. And then finally, what I will share, and then we can have as many questions as you would feel is prudent. What you need to do is you need to take inventory of risk. And if you can take inventory of risk as a community and decide it is just too dangerous with too much spread, if that's the case, then what we need to do is take a deep breath, pause, and have, in that case, a month of stay at home. Going out for of course, food and healthcare, but staying home is critically important if you really want to knock the virus down. So if you want to kick the virus's butt, that's the very best way to do it. And then it's gone. And then we don't have this slow burn and sometimes surge. So that will become my recommendation if over the weekend we see a lot of additional cases, or if at any time I feel that the hospitals will be overwhelmed to the point where we wouldn't be able to care for our kupuna. So that's how I approach it. And it's just a great challenge. It's a terrible sadness when we lose any of our loved ones. I will say in advance, of course, we lose loved ones for all kinds of reasons. Sometimes it's cancer, and sometimes it's heart disease, and sometimes it's tragic accidents, but and it's sometimes the flu, which is obviously the case. But the flu is something we can protect against. We have vaccinations. Not that I don't demagogue that issue, but if it's for you, you can prevent the flu and you can get some protection from everyone else around because they're protected. Also, it's only 1 out of 1,500 people die of the flu. It's 1 out of 100 are dying right now in Hawaii of COVID, and it's higher on the mainland. So it's 3 out of 100 who get COVID have been passing away. So all of these considerations are how I'm approaching it, mostly as a physician, less as a lieutenant governor perhaps. But I do try very hard to just give people the updated information. That's why I shared with the church my number and my social media handle, so people, if they would like to see it, every day I give these numbers, and with a little color just to maybe sometimes make people smile. But it's important that we know that the sky is not falling. However, if we did let COVID roll over us completely without any protection at all, we did project there would be over 4,000 fatalities in Hawaii. And that would just be too much to bear, honestly. So instead, we're, from my perspective, doing most of the right things to fight the virus back, to get to a vaccination. And at that point, we can get immunity, herd immunity, protection, and our lives will continue. So if I may stop there, I think that's about the right amount of time. Yeah.
Wow, that's a great summary, and we're always so grateful for you. As I said, you're our local Dr. Fauci, so fantastic. So so many questions are coming in right now, but one asks, which is a very fair question, what should be our case count expectation? I mean, in other words, what do you think is an acceptable number of daily cases? I mean, we're not hoping and praying it goes to 0 every single day. That's unrealistic. But is there in your mind, this is an acceptable number of daily cases? And does that help or not help the whole thing about herd immunity, that if a certain number get it, then we start building resistance in society, and then we're going to be good in the long run. Or maybe that won't happen unless we have vaccines. But is there an acceptable number that you think we're going to get them, but this is okay?
Yeah, I definitely can answer the question directly for you. So I will use the word manageable. A manageable number of cases is 50 per day for our healthcare system.
That's helpful, super helpful.
Yeah. A preferred number is 20 or less, because that drives the number and the viral load so low that it can finally burn out if a couple good decisions are made here and there, and we prevent large clusters from occurring in surges. And what I can tell you also is once we reach an active case count of somewhere between 3,000 and 3,500, it necessitates, in my mind, a pause for a time, because we cannot allow that number of people to then become hospitalized as a percentage and not have capacity to take care of ourselves. So those are the numbers that would help. Now, to get actual immunity, we probably are going to need a vaccination, and I'll be asking, I'll be spending some time soon with Dr. Fauci, and I'll share that more with you in the coming week. And I will ask that question of how we can achieve herd immunity and better immunity when taking into context a lot of travelers into the state, which is always a big deal for us. We have 1.4 million people, but we're accustomed to having 4 or 5 times that number in travelers to our state. Sorry.
So let me ask you about that. With tourists coming in or semi-returning residents coming back, I noticed that other countries like the UK, they're looking at a product called Virulence, approved by the UK. It's self-administered by 20 seconds per person. I know the FDA is in the process to thinking about approving it. The cost estimate's about $20 or less. Are you familiar with that or similar products? Is that something hopefully we can go to so that people can get tested quickly?
Yes, you're talking about paper tests, and yes, we are pursuing that very
This one's a
aggressive.
swab, I think. I think this one's a swab, the Virulence.
It could very well. So there's antigen tests, which tend to be swabs, and they tend to be either cheek swabs or anterior nares swabs, the front of the nose where we have an occasional booger. Okay, and so in that area or in the cheeks, you can get enough adequate sample, basically very non-obtrusive, to test for a lot of people. It's a little less accurate, but it's really quite, it's really quite good to have a much broader way to test people. There may even be some less expensive tests, but at $20 rather than $139, obviously we can do mass testing, and that is necessary. We expect that to be available to us. Obviously, we've been discussing whether or not there will be a time in the near future that travelers should come, and it's just simply too much right now. So I don't think anyone should worry that September 1st is going to be the time to travel yet. Even if we did open up, there'd be so few travelers, it wouldn't really be impactful for the economy. So, but that kind of test could rule out a lot of disease, and it'd be good at schools, at fire stations, at church, for instance. Let's say you just wanted once a month to check a lot of people. That'd be a good way to go.
Great. Hey, many questions on using, oh boy, I don't know if I can always pronounce it, hydroxychloroquine. Yeah, yes. And they're asking, is it okay or not? Should we be taking that? Is that going to work? So I'm condensing about 20 questions into one here. So.
Yeah, okay, so hydroxychloroquine, right now, mainstream medical communities are not recommending it. There are some people that do. I would not fault a person if they made that decision. It's relatively benign. Hydroxychloroquine, usually used for an immune problem called lupus, does kind of affect the immune system, and there are some people who think it helps. It does, on occasion, cause cardiac arrhythmias. So to use it for a large number of people in a population can be a concern, because then the larger the population that takes anything, whatever it is, it will then, of course, resonate with more numbers of people that get the effect or the side effects. And you could get bad heart problems with that. It can also affect your retina and your sight if you take it for a long time. So these are issues, but I know people are looking for cures, and remdesivir is the other one, but it doesn't really necessarily cure you. It just decreases the length of the virus in your body, and it's very expensive. So there's a back and forth about this stuff. What does work, we believe, is an old tried and true medication for inflammation, which is dexamethasone, which is a steroid. And those steroids are kind of magic drugs. Now, I'm not going to say they don't have any side effects. They can upset your stomach and cause an ulcer, but they do very greatly reduce inflammation, especially in the lung tissue. And that's obviously what you need a lot of times if your lungs have filled up with fluid. So jury's still out. All these treatments have not been studied. That's the challenge, okay? It's too fast to do the proper double-blinded studies, so you just don't know. But that's going to continue to be part of the dialogue. Unfortunately, that one got political. I try to stay non-political. So if it's demonstrated to be good and the medical community recommends it with good studies, then I go for it.
Okay. As you can imagine, a lot of questions. Basically, is it safe for students and teachers to be in-person classes? There just seems to be a lot of different views on that. And what's your honest advice to our learning institutions and parents?
Not quite yet. I think that there's just too large a surge at the moment, and it's disconcerting for sure. The numbers have to come down a little bit. We have to have the capacity to do testing and tracing like you were just referencing in order to really clear ourselves and be okay. I think we will be okay in a month, at least certainly better. Also, teachers are now frontline workers in the response to COVID if you put them in the classroom with a lot of kids. So that really merits a lot of extra protection for them, and I don't see that there.
Now, I could be wrong in this, I think some private schools and maybe some charter schools are allowed to have in-person classes when public schools are closed. Is anyone inspecting all schools to be sure that they have implemented safest practices and will monitor them continually?
Highly doubtful. I have one child in a charter and one child in a private school, and I will tell you that the private school has extraordinary preparation in place, and they've given us a lot of confidence that when they go back, which it's going to be sometime late September, they'll be ready. And of course, everything's subject to change. I mean, if the cases had gone to 500 and 700 a day, I don't think anyone would be talking about in-school learning for this semester. But the cases could very well come down and it could be made safe. I don't think there will be nearly enough inspectors. I don't think that's possible.
Okay. Dr. Tim Brown at East West Center at UH said that 1 in 50 people he felt in our community have COVID right now.
Yeah.
So can you talk more about, like, is it 40% of asymptomatic carriers in the state? I mean, who's monitoring? How can we monitor that problem if that's true? Is that true?
Yeah,
you agree with that?
It is true. We have an active confirmed caseload of 2745, and we've had a total number of tests positive, like I said, 4,500, right? But everyone feels it's at least 10 times that number that's been studying it. So that's probably 45,000 people over time may have actually had the virus. It might not be quite that high, but that's what the suspicion is. In which case we would have some more immunity. And many of those people had no symptoms at all or very mild symptoms like a cold, a little bit of sore throat, and that's it. And that's how it sometimes works. So it's pretty hard to know completely without doing a comprehensive sentinel survey, which I've asked the Department of Health to do.
So speaking about the Department of Health, we hear about tests being sent to the mainland or local private labs. So what's the capacity of the state lab, and what percentage have they been handling of total tests?
Well, the capacity right now, first of all, statewide, if they have to get all the tests run, the most they could run in a day would be 8,000, setting aside the pooling technique, which hasn't been streamlined yet. We normally do, however, without straining too much, closer to 3,000 tests, which is up significantly from even a month and a half ago when we would only do 1,200 tests a day. The state lab itself only runs a few hundred labs a week. Excuse me. However, sorry, that was popcorn. That was not COVID for those who are watching. I have a popcorn kernel.
I better put on my mask even though we're doing Zoom right now.
You guys are good. But the state lab runs only a few hundred tests a week, but clinical labs of Hawaii and Kaiser's lab and so on, they run thousands of tests. And then if we have to, we can send tests off to the mainland. But unfortunately, the results come back, they just come back 5 to 7 days later, and it drives everyone mad. So that's the real reason that we should be adding more rapid testing, even some of those almost instant tests, which will come in time. There's an incredible amount of economic pressure to get that done. And as long as the test gets tested well enough to be accurate, then it's great. And we can use multiple layers of testing if need be.
Okay. By the way, a lot of you are really akamai on Zoom and you're hitting the button of raising your hand. Guess what? I can't see your hands raised. So if you have a question, put it into the Q&A, type that in, and then I'll try to get to it. If you came in late, I gave a early in the prelude apology. I can't possibly get to all the questions. There are more than 100 questions rolling in right now. So we're going to zip through as many as we can, but I'm apologizing ahead of time. I'm trying to, I'll try and see your question if I can. Now, one person's asking, now, shouldn't we actually be more concerned just by the death rate and not the number of cases? Shouldn't that be the number we look at?
It's a great question. Both are important for a couple reasons. The death rate, of course, is the ultimate number, right? However, the research is already showing, and we're concerned about this, that individuals who catch COVID could have long-term effects of COVID. And they could have scarring to the lungs. There could be some cognitive effects. Some people are having difficulties with memory and their mentation. We have heard several stories of it being an immune problem for people. And some people are getting what's called a cardiomyopathy or myocarditis, swelling of the heart muscle. So a lot of individuals who catch it may have modest symptoms at first, and then it ramps up. Thank goodness most don't die, but I know of a 48-year-old that's now got congestive heart failure as a result of having had COVID a few months ago, and because their heart was damaged. So there are things to be considered beyond the death toll, but all of these things are what drive the decisions that are made. And none of those decisions are easy, because I know that they have consequences, whether it's economics or people have children that need to continue to do their social development or time away from our parents. There's all these considerations, but the largest one does tend to be fatalities.
Okay. When a person does have coronavirus, does the whole family have to be quarantined if somebody in your family has COVID-19?
They technically don't have to be quarantined for the full 14 days. The individual who's got COVID needs to be fully isolated from the family. Otherwise, they should. If they cannot isolate successfully away from their loved one that's positive, and it's challenging, I know, because it's a small house or what have you, then you really should home isolate or kind of approximate staying at home. Might go get groceries quickly, but be very diligent then about wearing a mask. The moment anyone has symptoms, of course, they should get tested. And you can rest assured that if you have symptoms suggesting COVID and your loved one, your husband or wife has a case of COVID, you're going to have it.
This question comes up so often. We have never shut down for the flu before. And so why should we despair so badly about these cases when many are getting through it fine and not overrunning the hospitals, at least as of yet? You've probably heard that comparison with the common flu.
Sure.
So why are we in despair, as this person say, for this one?
Well, so the main reasons are, first of all, we can't really give protection to others from COVID if there's a large number of people running around with it, because there's no way to get a vaccination for ourselves to protect one another or to protect my family if some other family has decided to have COVID and run around and be out there. That's one main reason. The second reason is because the mortality rate is probably 15 times higher for COVID. So and that's a pretty big difference. It's not without risk. The corollary question, which most people will ask after that, is, well, then in that case, why don't we just take those who have the greatest mortality risk, people who are over, say, 70 years old, and have them isolated at home very carefully, and the rest of us just deal with it, catch the virus, and get immunity? And that is a possible approach. it's difficult to manage that because it's still difficult to separate. And young people will be taking care of seniors at nursing homes or at hospitals, and it will be reflected with spread of the virus that way.
Okay. Now, a lot of people come up with a lot of different ideas that they would love to share with the state, best plans how to reopen. Some are saying, hey, let's give all the tourists an orange wristband that they can't take off. And,
Yes.
we'll know, hey, how come you're at the beach or you're running around and you're not quarantined? Then we'll know, hey, you're an orange band person. But if someone has an idea to help with plans to reopen the state, what's the best way, most efficient way, really, to pass that on for consideration? Or is the state just overwhelmed, like, don't give us any ideas?
No, that's kind of why I shared my cell phone and social media handle with everyone here. You could text me. You could just say, I was on your call with Pastor Dan, and here was an idea. And I vet ideas. I mean, there are some ideas, like when we had the volcano going up, somebody told me we should drop a nuclear warhead in the volcano and that would stop the problem. And that was a pretty bad idea. And so that idea I didn't pass on.
I would think so.
Yeah. But if someone, and many people have given me very good ideas, of which some have been implemented. And so, and also when we reach a critical mass of people expressing concern or areas of spread of the virus, I am able to pass it right on to the top people in the state and the General Hara's team and the rest of Haima and all these guys. So they should write me directly. A couple people have already written me or texted me since we've been talking from your church. So it's great. And so if it comes to me, it's coming really high up right off the bat in a way that can get to people. It's not that important. Just I will get the idea to the right Department of Health people, and hopefully they can take some action.
Right. And maybe somebody on the HIM team, can you paste that into the Q&A right now? Again, his cell number, and I don't know if you gave your email, but at least the cell number that you gave before. So team, if you could put that in right now, that would be fantastic. And boy, are you going to be sorry for that, Lieutenant Governor?
No,
You're ready for the text rolling in.
I love people. I hope that people give me ideas. And if just be aware, if I'm really sleepy after being on call, I can be sassy. But except for that, I'll be very welcoming of all input. And probably text me these ideas during the daytime or when there are emergencies. That's the best way. But if you have an idea, just get it to me. I'll try to figure out whether we can use it. Okay,
we'll put that in the chat. How's that? And then they can see it. Oh, I think it just popped in just now, and that should have gone to everybody. A big question, this is the big tension. How is the government balancing the health needs for our people and that of our industry economy? Right now, it seems to some people, all decisions are being made solely based on health, even though the state and this person thinks bankruptcy is imminent. So that is the balance people are concerned about. And what is your view on that?
I think that is an appropriate perspective. It has to be balanced. If we go much longer, we're going to either have to tell people we have a full commitment to keeping them financially whole through January and just understand that they deserve to be kept whole financially to help deal with the great hardship that's put on them by lockdown. I've even gone so far, and this may not be, I'm not sure this will be a popular opinion with a bunch of individuals who are pretty spiritual and probably very much in the straight and narrow, but take bars, for instance. Bars are not my main thing, but we've all been to a bar, I guess, or two in our lifetime. If we shut down just bars and nobody else, and they have good workers and most of them are trying their best, I think we should pay some of their overhead and certainly take care of all of their unemployed individuals and make sure that they don't lose their leases. Now, of course, I'm even more comfortable supporting churches who are supporting people or supporting clinics that are taking direct healthcare people if they suffer some kind of economic consequence from shutdown, because those groups are, I don't want to be like this, but they're better for society, okay? But anyone who suffers at the hands of a full-on rule or a law that they can't avoid and they follow it deserves to be helped. So we should also have some significant support to make sure people who are housing unstable get support for their rent. Even landlords, there should be some support there. And my expectation is for every month that we have to maintain kind of a robust amount of social support and financial support, it probably will take about 6 months to recover fully from that. I will say this, we are getting federal monies. That's important. We are needing to use them in lots of places like healthcare, and airlines are going to need it so they don't close. That would not be acceptable to us in Hawaii. And then, most importantly, we can get through it, but it will take some time to dig out of the debt. But I think that there's going to be an incredible pent-up desire to travel to Hawaii once we're kind of in the all clear. And that will likely happen sometime early next year. I anticipate very large numbers and economic booms actually coming to Hawaii shortly after the virus is gone.
You mentioned churches. What advice do you have? What would you recommend to churches regarding their live gatherings? I mean, one could say they're high risk, large numbers of people coming together. There's singing. Some churches, maybe they're not legislating the masks.
Yes.
What would you recommend?
My personal recommendation would be just be safe and smart. Churches should not be ever singled out more than others. I think right now, it is smart to say to anyone, we don't want gatherings in a single room of more than 10 people. So, but let's say you have a church with 30 rooms. If people can go to each of those rooms, having 10 individuals in each, especially in their social bubble or family, is completely acceptable in my mind. And you'll be able to socially distance some, but you really don't even need to. If it's, let's say it's a loving family of 7 and they're best friends, they're 3 best friends that they're already with, it's no additional risk. And it's a slightly unusual approach to having church, but sometimes it's okay. Also, there are, as I know, some of our churches have very large spaces, and it can be done to keep people apart from large clusters. And we get through this period safely, and we can then come back more robustly for our church services or our restaurants or our conventions or anything that's a large gathering of people. And so that's my recommendation. I also think that it would be good for any institution, and I count like, I just count hospitals and clinics and churches and just so many nursing homes and prisons. They're all institutions. Every institution should be able, in my opinion, to be able to take temperature for people coming in. Is very prudent, and to have just good communications teams saying, if you're sick at all or you have a close contact, and I mean any close contact that's had COVID, please stay home for this 14-day period. You do those things, you're not going to have spread, not much. Your challenge, of course, is that your church is so big and so good that with 1,500 people, the probabilities will catch up to you more likely. And there is a stigma associated with outbreaks. It's not fair usually, because your outbreak is not going to become because a lack of professionalism occurred. And it's not going to be because you had someone who was behaving badly, like let's say was taking a lot of drugs and came in and disregarded other people's space. That's not going to be your flock. But what will happen is just there's so many people that you have people working all over the state, especially over Oahu, and you have a higher risk for having a cluster. I'm sure there must be some people in your church that have tested positive. And, and if they happen to be unlucky and didn't know it, and they came to a service 2.5 months ago, we were rolling the dice that day completely innocently.
Right. And, and HIM speaks to hundreds of churches all throughout the state and so many on the mainland. And I know many of the people who are viewing it right now may not be a church goer, but it's in case you do know about the church I happen to pastor, we actually decided not to worship in person, and but I know many are, and so no judgment on how everybody makes their call, but we are all concerned of how to make the best health moves for our state. I don't know if you've heard, Lieutenant Governor, that Google and Apple are developing apps that provide contact tracing capability. Has that deployment, that deployment has started on the mainland, I believe. Any status of deployment here in Hawaii?
Yes. So we are using the Google software for our surveillance and tracking of individuals coming into the state for the counties. And that will include individuals like any of us as travelers who will be using that database, that digital database, to share and to help with tracing and tracking. It is always, the more of these things you do, there are some privacy consequences. They're not too severe. Honestly, if we have Apple phones, or Galaxies, or I'm assuming it's pretty easy to tell where we've been wandering around. But that is available. And the Department of Health, which is undergoing some leadership changes right now, and necessarily so, they're making a little switch up for people that are more focused on the tracing programs. They're now getting my recommendations, which have been many, about this kind of thing. I definitely think that we should use one of those products. Also, the MIT software has been highly touted as good to help with tracing. So it's an era where we do a lot of tech work. And I mean, I'm kind of connected at the hip with my Apple Watch and the phone. So I think it is good to use.
Great. You know, speaking about tracing, you once said, and maybe you still believe this, we need 550 plus contact tracers.
Yes.
I think we have about, I don't want to say this wrong, 50 right now. So how long will it take to get full strength of contact tracers? And it's interesting, it seems your estimate for the need of contact tracers is different from Dr. Park. I thought she had a lower.
Yeah, she messed that up, you know, and it's not because she's not a good person. It's because her priorities were not placed in that area. The recommendations are 30 per 100,000 from one organization and 40 per 100,000 from another. So that's the range. At 30 per 100,000, we need 420 contact tracers. At 40 per 100,000, we need 564 contact tracers. And that can be a fleet of different people. We have just slightly approaching 100 now, but we only had 15 full-time individuals up until last week, when that was unfortunately uncovered the way it was. And I don't mean it was unfortunate that's how it was uncovered. It's unfortunate that we only had that few people. So it was just not a philosophical priority of the Department of Health at the time. And they were unable to keep up with this large surge, which did come on quite aggressively. To again remind people, we had only 900 cases for the first 4 months. Then in the next month, we added 1,000 cases. And now we've already added 2,000 cases in just 14 days, sorry. So the curve looks like this. It's a exponential growth, and it can be curtailed. It's been done many places, including here in Hawaii, when we were able to knock it down to nothing. But they didn't have the tracers in place. Now they're hiring them. We have 450 people that have been hired. We have 68 individuals that can be loaned from the National Guard, and we've had hundreds and hundreds of volunteers raise their hand to ask to help. So I'm completely confident that we can do it. I do think, however, they can't keep up. Nobody can keep up with the number of cases we have right now, and that's why there's been some additional restrictions that are coming.
Great. Now, this is really hard, but you know, we've been talking about masking and social distancing and hand washing.
Yes.
But how do we encourage personal responsibility on everyone's part? I mean, now you all have to be the preacher in a sense, right? I mean, how do you convince the public you've got to do this? I mean, any
it's difficult. I think that it goes in waves. Sometimes people are more responsive than others. Young people have a challenge to listen, and that has to come from the elders that they trust, the family members that they trust. But my concern is that people in a circumstance like this, where it's pretty new to our experience to have an outbreak like this, that people will only learn when they see what is quite tragic, which is to say, when the pictures come out of the hospitals 10 days from now, when there are very giant numbers of people in the hospital and going into the ICU, and even some pictures of those who have passed away, then people will get serious because they'll get scared. And that's human nature. Now, I've said it, I'm sure that I'm now over 10,000 times having said that people need to wear a mask and socially distance and be careful to not spread the disease. And I'm probably the most reputable guy, at least in health policy here in the state. I mean, overall, I'm pretty benign and I work in the ER. So not too many people think I'm full of baloney, but they still don't listen to me a lot of the time. So it's a challenge, you know, and I don't blame people. I don't fault them and I don't judge. I just know that we could do better, and I don't like to preach at people. I just like to tell them the facts and see that they are aware of those facts so they can decide for themselves. If people could see a glimpse into what it looks like when someone's on a ventilator that's young or younger that shouldn't have been there, that will tell the story.
Is there a number we have to hit in order to eliminate all 14-day travel quarantine?
To eliminate all the quarantine of any kind, that might be a reflection also of the number in certain parts of the world. We are hopeful that we'll be able to allow a travel bubble with Japan if they'll have us now. Our numbers have been higher, right? As far as the carrying capacity for us, if we're in the 10s or 20s, there's no special reason to have a quarantine coming here. The best thing that I was able to recommend was a quick test. And if it's a non-invasive test, they're often referred to as NAAT tests, nucleic acid amplification test, nucleic acid amplification test. Those are the quicker ones, and you can quickly do that. It also includes the PCR test. You knock down the numbers very significantly. You do a test 3 days or so before you come, and sooner or later, we'll be able to do them right at the airports, actually. And then people will get a negative test, and they'll be excitedly coming to Hawaii or going to wherever we're going. That's coming, and people are doing that already. In Japan, they're already doing those tests. I believe in Europe, they've begun to do them. So there's a lot of hope, and I know that that will be what we do in 2021. But right now, we're still scrambling to deal with the acute phase of the crisis.
Okay, so there's not a number like, we only have 50 cases, then we're done. You know, everything's
back to normal. As far as travel, nah, it's probably lower than that, because at 50 cases, it translates to obviously 600 per month. And if it's 600 per month, we can manage that, but we hate to see travel spread also. If it dies off in the mainland, then it will be very good to have travelers here. If for instance, if their rates drop below ours, then it's a non-issue. Honestly, I hate to say this because this might make people a little edgy, but travel to here is really not the big problem. The big problem is just that the virus is spreading around here. It was prudent to keep travel from coming here when we had low numbers and they had high numbers. When we have high numbers and they have low numbers and people are being careful to not travel when they're sick, it doesn't add anything to us. It's just that then we would have our hotels open, all of our restaurants open, presumably, and you would see our own selves out too much spreading. That would be the challenge.
So what would be this is hard, I'm sure. What should the number be to be back to quote unquote normal? You know, you don't have to be 6 feet away. The hotels are fully open. Restaurants are fully open. It can't be zero, or is it? What would be the number like we can fully open up as the old days?
If we're not seeing surges, and especially if we have a vaccination. Now, a nice person already texted me and said, are vaccinations going to be mandatory or not? No, they will not be mandatory. I want to assure you that I will not support mandatory vaccinations. I think that people should have free will when they choose such medicines to put in their body. I mean, I personally will take the vaccination, just so you know, but I won't mandate it as your lieutenant governor or you know, if I'm acting governor. But when the governor travels. But the truth is, you get down to a low enough number that we're not seeing significant community spread, 15, 20 cases a day, it's a non-issue.
Okay.
And then we can be moving about.
People are asking some very specific questions. So the positivity rate is 8.8 today, I think.
Yes.
Yesterday it was 10.5. So yes. People want to know, why is this important? I mean, why are these figures so important? And then, you know, in terms of tracing it all, when we do find out what people have, is that tracking and tracing a violation of some HIPAA rule of some kind? So it's kind of a double-edged, a two-part compound question.
Yes. There are definitely some privacies that go away when you're asked a specific question and you're not obligated to answer. There is a loss of personal rights on occasion. If someone is an active health threat to their community, the director of health in our state is allowed to mandate quarantine. If we talk about the total number of cases, excuse me, and the number of cases continues to go up by percentage, that's a sign that it's just more prevalent in the community. And therefore, we really need to do the contact tracing and testing. And mind you, it shouldn't be really much of an imposition to have that question asked of the person and to share, because it's not, there's really no stigma. It's just you got coughed on or sneezed on or someone breathed in your face for too long when they had the virus. It's not as though you behaved badly or you did something to contract a disease that really puts you in a bad spot, a judgmental spot. So I think we should have comprehensive contact tracing and testing. I am a little personally concerned about some of the apps that tell wherever a person went at all times. And that's that's a question of how we live our lives. Yeah.
Okay. Here are just a few more questions. Can churches coordinate with the state in helpful ways, particularly with regard to recruiting contact tracers or communication of some kind?
That would be wonderful. Yes, absolutely. If you have people that have that skill set or have gone through the course, if you can wrap a bow around a bunch of people within the church that would like to do it together, I've encouraged them very strongly with the new leadership run by Danny Tomayasu and a couple other individuals to welcome volunteers and to make it helpful so that they can come and be a part of a large effort. Churches are wonderful organizers, and often, and especially when they're working together with one another or other churches, which I'm a big fan of, they can move mountains. And so having a big motivated group together,
And who do they talk to? Who do they talk to for that? I mean, is there a...
They can send me updates and they can send me recommendations of a group, and I will immediately put it into the Department of Health people's hands. I think right now everyone is cognizant a little bit that I am pushing on this, and I am insisting that we up our game on tracing and testing, because I think it's a lot better than forcing people or even putting the prospect of people having to consider vaccinations or hospitalizations or what have you. So I'll get that information to them. And my email is, I should have also mentioned that, although you can text these things to me, great. It's josh.green@hawaii.gov. That comes straight to me. josh.green@hawaii.gov.
Okay, maybe my team can put that in the chat and then put it in. Yeah. Some people are more visual. You know, you have a lot of sources for your data. Can the public have these same sources that the data that you have? People are asking that a lot. Is there a place you can go to right away, or I don't know?
Absolutely. They can have some of the data from me, but I can't share the data that the defense community shares, or some of the Department of Health data is kind of privacy related. So the best thing to do, you will get the data, the direct numbers from me, right, that were reported, but I can't promise that I could give the actual forms that they put together. There's a couple reasons for that. One, sometimes they don't break out, they break out certain hospitals apart from one another. And there's a little bit of risk about sharing that and causing runs on some hospitals or away from others. Also, I do have some confidentiality considerations just for the purpose of being everyone's lieutenant governor. And I want people to be able to trust me with any data they give, no matter what it is. But I do distill the data daily and give these updates, which are, I know, far more in depth than probably they would like me to share, but I'm still going to share whatever I think is necessary to make sure we're safe and can give people a clear view of the whole picture so they can decide what they want to advocate for as far as being wide open or being shut, what have you. One piece of data people often ask me for is which part of the town or which street or which part of an island are all these cases in. And we do put some of that on the websites, but if you drill down too far on it specifically, it can violate certain people's privacies, and we could run some concerns. For instance, if one community is exploding, like we saw a large expansion of the disease in the Pacific Islander community in Kalihi, we started to worry a little bit that there was going to be too much bias against, in that case, it was the subset of the Pacific Islander community that was Micronesian. And it was a problem, but it wasn't one that we wanted to emphasize as far as anyone taking action other than public health action. And so we were mindful of that. So there's a lot of considerations, and I know people love information, me more than most. So I'll share all that I can, is what I'll say.
Yeah, great. And you're on Facebook every day, right? You do a Facebook report.
I do. I do Facebook and Instagram, and what else do I have out there?
What time do you go on to put that out
we usually release it around 12 or 12:30 in the day. I record it sometime late morning, and out of respect to the Department of Health, they like to often give certain information, and I defer to them to get it out until it's too late. Because people have to make their decisions about their day and their week and so on. And it's almost every day. Sometimes I do a quick, usually it's a minute or so of the rapid fire numbers and data. There's always more questions, but I can get to the next questions later and the next day or 2 days later or whatever. So.
Okay,
yeah.
Great. This will probably be the last question. And maybe it's a teeny bit controversial. I don't even know quite if it's true or not, but does it concern you that the state task force has more business CEOs and less MDs on it? I'm not sure if that's true. I mean, this is what somebody's asking.
It could be true. But, I for every group of people that are on that thing, I am including so many doctors and nurses in my conversations that those people are outnumbering in their input vastly as compared to these task force meetings. How the decisions get made at the state, Senate and House level, I don't know ultimately. I think they're trying to include a lot of good perspectives. But as you can see, even if that were the case, it would suggest that we would have opened up widely and not taken into consideration health first over economic issues if it was just the CEOs. And instead, it's kind of been the opposite. We've probably skewed more towards health over economic activity. So, but judgment call, I'm the lieutenant governor, not the governor, so I'm willing to own up to what I can control and just be as transparent as I can about what I see.
Right. I said that was the last question. There's one more, and it's just there. People want to know: are we heading for another shutdown in the near future? And and what can we do about these groups that are getting together to try to get infected on purpose, trying to gain herd immunity? So. I guess those are two questions actually, but let's make that our closing, and then I'll have a few announcements.
Sure.
Go ahead.
So I would say this: if the numbers are bad in the next 3 to 5 days, and the surge continues, I do think there will be additional restrictions that the governor would recommend. I'm pretty certain. I actually thought we were there yesterday, very possibly, but we're waiting now just a little longer. Because the hospital numbers plateaued overnight, it's okay. So we'll know in 3 to 5 days, I believe, whether we need to have a month of significant restrictions, maybe the stay-at-home order, just going out for necessary exercise, food, and healthcare, and working from home otherwise. If the numbers start dropping because of the decreased activity at parks and beaches and what have you, then it won't be necessary, and we'll just now rely a lot more on our contact tracing and testing program to really beat it down. People would be foolish to, in my opinion, go out and seek infection and try to achieve herd immunity. It won't work. First of all, based on the numbers of people, even if they could achieve that, they themselves could catch the disease sooner, but they will not achieve herd immunity for their community. You have to get up to about 70% of a society, and that's not going to happen here until there's a vaccination. So that's a bad strategy. Yeah,
that's good to know. I was glad some wisdom right at the end about that, but it's been wisdom permeated through the whole time we've had together, and we just want to say thank you so much, Lieutenant Governor. We realize you have a very, very busy schedule trying to take care of our state, plus you're an ER doctor on the Big Island. and we're just so very, very grateful. So we can say aloha to you right now, and everybody can wave and say
Thank you.
goodbye. And thank you so much for sharing this. And thank you for being our local Dr. Fauci and really always giving us straight talk, which is the name of this series,
You bet.
about real issues, real people in real time. So thank you. God bless. Thank
Thank
you,
you. Bless you
Lieutenant
too,
Governor.
Pastor Dan. Thank you so much.